What if I told you that just 7 straightforward exercises could radically change your bedroom performance, giving you erections so powerful they might even take you by surprise? And here's the part that few men realize. The seventh exercise is virtually unknown to the public, yet it has been a trusted tool among medical professionals for decades to help patients fully restore their sexual function after surgery. These aren't random movements pulled from the internet or untested gimmicks. They are proven, medically backed exercises designed to address the real underlying cause of erectile dysfunction, vascular disease. The first exercise may surprise you. While it's often thought of as something only women practice, men who commit to it have reported up to a 75% improvement in erection strength. We're talking about Kegel exercise as a simple, discreet, yet remarkably powerful method that strengthens the pelvic floor and restores control over your sexual performance. Your pelvic muscles are found on the back along your tailbone up to your pubic bone in the front. Why are pelvic floor muscles important? Because these are the muscles you use to control your bladder and bowels. Your pelvic muscles also help in attaining and maintaining erections. To do a proper Kegel, the first step is to correctly locate the pelvic floor muscles. A quick way to find them is during urination. Briefly try to stop the flow midstream. The muscles you engage in that moment are the ones we'll be working on. But remember, this should only be used as a test, not a habit, since regularly stopping urine flow can cause bladder issues. Once you've identified the muscles, the technique is straightforward. Clench those pelvic floor muscles, hold for 3 seconds, then slowly release. That's 1 repetition. Begin with 3 to 5 reps, aiming for at least 3 practice sessions a day. Over time, you can gradually increase the hold to 5 or even 10 seconds for maximum results. Timing matters too. Many specialists recommend practicing Kegels during calm moments like while sitting at your desk, relaxing at home, or even lying in bed before sleep. According to a study published by the National Library of Medicine, 40% of men with erectile dysfunction regained normal erectile function after a structured pelvic floor exercise program, and an additional 35.5% experienced significant improvement. Real-life examples show just how transformative this practice can be. David, a 47-year-old from Los Angeles, struggled with weaker erections after years of sitting long hours at his tech job. Within 6 weeks of consistent Kegel practice, he reported firmer, longer-lasting erections and a renewed sense of confidence. To boost effectiveness, combine this exercise with deep, steady breathing and improved circulation techniques such as brisk walking or light jogging. Diet also plays a role. Adding foods rich in flavonoids like blueberries, citrus fruits, and dark chocolate, or incorporating heart-healthy fats like omega-3s can enhance blood vessel health and further support erectile function. One common mistake men make is overdoing the exercise. Just like any muscle, the pelvic floor can become fatigued if strained excessively. This may temporarily worsen symptoms such as premature ejaculation or pelvic discomfort. Balance is key. Consistency matters more than intensity. With Kegel exercises, the promise is simple yet powerful: better control, stronger erections, and renewed confidence. Done correctly and consistently, this secret weapon doesn't just enhance performance in the bedroom, it strengthens overall pelvic health and supports long-term vitality. The next exercise is so simple you can do it while watching your favorite show, but don't let its simplicity fool you. This movement activates muscles that can make your orgasms last significantly longer and your erections remarkably stronger. We're talking about hip bridges. At first glance, lying on your back and lifting your hips seems far too simple to have any impact on your sex life. It works by activating an entire network of muscles often overlooked: the glutes, hamstrings, and lower back. These muscles form the structural foundation for pelvic stability, which is vital for sexual endurance. Even more fascinating is the engagement of the bulbocavernosus muscle, a lesser-known but critical player in male sexual function. This muscle helps trap blood in the penis, ensuring rigidity during arousal and pumping during ejaculation. Strengthening it through hip bridges directly translates into better erectile quality and control. Clinical evidence also supports these outcomes. A study in the Journal of Sexual Medicine highlighted that exercises targeting pelvic muscles, including the bulbocavernosus, significantly improve erectile rigidity and duration. To perform the movement, lie flat on your back with knees bent and feet on the ground. Press through your heels, lift your hips toward the ceiling, and contract your glutes as if trying to crack a walnut. Hold for 3 to 5 seconds before slowly lowering down. Start with 10 to 15 reps, 3 sets per session, and practice 3 to 4 times per week. For progression, incorporate single leg bridges or elevate your feet on a bed or couch. These variations intensify the demand on your core and pelvic stabilizers, further enhancing results. The ideal time to perform hip bridges is in the morning, when your testosterone levels are naturally higher, or in the evening after light stretching to ease tension in the lower back. Pairing this exercise with cardiovascular activity, like brisk walking, amplifies circulation benefits. To maximize efficiency, add a diet rich in nitric oxide boosters, such as spinach, beets, and pomegranates to support blood flow. However, not all foods are good for health. The important thing is to suit your wishes and yourself. Here I have a video about 7 types of fruits eaten in the morning that will kill your erection ability. To find out what they are and have a perfect diet, follow the link I pinned in the description. Many men make the mistake of rushing the exercise, using momentum rather than controlled muscle contraction. This reduces effectiveness and may strain the lower back. Focus instead on slow, deliberate movement, fully squeezing at the top. Have you ever considered how a simple yoga pose could lead to a dramatic upward trend in your bedroom performance? Yoga has been practiced for thousands of years, often associated with flexibility, stress relief, and inner balance. But beyond its calming reputation, yoga is now backed by modern science as a powerful ally for sexual vitality. Improved blood flow through yoga ensures tissues in the pelvic region receive adequate oxygen, supporting firmer erections. At the same time, lowering cortisol is critical, since elevated stress hormones divert blood away from sexual organs. A 2011 study published in the Journal of Sexual Medicine confirmed that regular yoga practice improved sexual desire, performance, and satisfaction in men within just 12 weeks. 2 poses are particularly effective for enhancing bedroom performance. The bridge pose resembles the hip bridge but focuses on sustained engagement. Lifting your hips and holding the position for 20 to 30 seconds while breathing deeply not only strengthens pelvic muscles, but also opens blood vessels in the groin. Repeating this for 1 to 2 minutes daily can dramatically improve stamina. The cat-cow pose, meanwhile, enhances flexibility in the spine and pelvis, easing tension while boosting circulation. Start on your hands and knees in a tabletop position. Inhale as you arch your back, letting your belly drop toward the floor. Exhale as you round your spine, tucking your chin to your chest. Repeat this movement slowly, following your breath for 1 to 2 minutes daily. Best results come when yoga is practiced consistently, ideally in the morning or evening when the body is relaxed. Pairing yoga with mindfulness or meditation intensifies its stress-reducing benefits, creating a mind-body synergy essential for sexual health. A diet rich in magnesium, found in nuts, seeds, and leafy greens, complements yoga's cortisol-lowering effects by naturally calming the nervous system. Men often underestimate yoga, dismissing it as too gentle. But the reality is far different. In Miami, Anthony, a 50-year-old lawyer, turned to yoga after years of performance anxiety. Within 3 months, he noticed less stress, more energy, and firmer erections. Simple, consistent, and deeply restorative, yoga is more than just exercise. It's a holistic practice that strengthens not only your body, but also your confidence and control in the bedroom. Sometimes, the most powerful solutions really are hiding in plain sight. And if this information is helpful to you and your loved ones, please enter the number 1 below in the comments section to let me know you're still following along and ready to explore the next exciting exercise. Remember how we talked about the importance of the pelvic floor for maintaining strong erections? Well, here's something that might surprise you. Planks can do way more than just give you impressive abs. By targeting your core and pelvic floor simultaneously, this exercise boosts stability and blood flow in ways that will shock you. One particularly powerful version is the forearm plank with hip dips. By slowly lowering your hips side to side while holding a plank, you don't just challenge your abdominal muscles, you activate the deeper pelvic stabilizers that play a direct role in erection control and endurance. This dynamic motion also stimulates blood flow to the pelvic region, which helps with maintaining rigidity and delaying fatigue. To practice safely, hold a straight line from your head to your heels, keeping your core engaged. Beginners should start with 3 sets of 10 to 15 hip dips, holding the plank 30 to 60 seconds between sets, 3 to 4 times per week. As strength improves, extend the time under tension and add more reps. Research published in the Journal of Physical Therapy Science found that pelvic-focused core strengthening significantly improves blood flow and stability, contributing to better sexual function. Form is crucial. Many men make the mistake of letting their hips sag or arching their lower back, which shifts the strain away from the pelvic floor and risks injury. The key is controlled, deliberate movement and steady breathing throughout. The best time to include plank variations is post-workout, when your muscles are already activated, or in the morning to energize your body for the day. Pairing this exercise with deep diaphragmatic breathing or even short yoga flows amplifies its benefits by reducing tension and improving oxygen delivery. We're coming to an exercise that most people never talk about, but its benefits for erections and sexual function are absolutely incredible. It may surprise you to learn that something as ordinary as a wall can become a powerful tool for revitalizing your sex life. Wall sits, often overlooked in fitness routines, are uniquely effective for strengthening the muscles that support pelvic stability and enhancing blood flow, 2 key factors for stronger, longer-lasting erections. The movement itself is simple but deceptively intense. With your back against a wall, slide down until your thighs are parallel to the floor, holding the invisible chair position. Your quadriceps, glutes, and core engage together to support your body weight, while circulation to the pelvic region increases significantly. Consistent practice helps maintain the vascular health necessary for erectile strength. For beginners, holding the position for 20 to 30 seconds per set is a strong start. Over time, aim to build towards 60 seconds or more, performing 3 sets 3 to 4 times weekly. A 2019 study in the American Journal of Lifestyle Medicine confirmed that lower body isometric exercises like wall sits improve endothelial function, which directly correlates with better blood vessel health and sexual performance. 2 pitfalls to avoid are arching your back and letting your knees collapse inward. Both mistakes reduce effectiveness and constrain the joints. Instead, keep your back pressed firmly against the wall and align your knees over your ankles. The ideal time to practice is after light cardio, when your muscles are warmed up and blood flow is already elevated. Pairing wall sits with nitric oxide boosting foods such as beets, leafy greens, or watermelon can further amplify their circulation enhancing benefits. Real-life transformations illustrate the power of this simple move. In Dallas, Marcus, a 52-year-old marketing executive, began wall sits after noticing early signs of erectile decline. Within 2 months, he not only improved sexual function, but also reduced his knee discomfort thanks to stronger leg muscles. What makes wall sits so effective is their dual role, building muscular endurance while promoting vascular health. Done consistently and with good form, this humble exercise can become a game changer in transforming both fitness and bedroom performance. This next method isn't something you'll hear about in everyday conversations, yet it's one of the most trusted tools in clinical practice for restoring sexual health. Known as penile vacuum therapy, this exercise is routinely prescribed by urologists and rehabilitation specialists to help men recover function after prostate surgery or to treat erectile dysfunction caused by vascular issues. The principle is simple but powerful. A cylindrical pump is placed over the penis, creating negative pressure that draws blood into the erectile tissues. The result is an immediate erection that not only supports sexual performance, but also rehabilitates the penile tissue by encouraging fresh blood circulation. For some men, a silicone constriction ring is applied at the base of the penis after pumping to help maintain firmness for longer durations. Sessions usually last 10 to 15 minutes and can be performed several times per week. Some specialists recommend daily use for 15 to 30 minutes, but always with caution to avoid tissue damage. Automatic pumps are often preferred over manual ones for their consistent pressure control. Still, guidance from a pelvic floor rehabilitation therapist or urologist is highly recommended before starting, as using the wrong device or technique can lead to pain, bruising, or even ischemia. The ideal time to practice vacuum therapy is in the morning or evening, when the body is naturally more relaxed. Practical experience shows how life-changing this tool can be. George, a 58-year-old from Miami, who underwent prostate surgery, regained spontaneous erections within months by combining pump therapy with guided pelvic exercises. In Los Angeles, David, 61, who struggled with diabetes-related ED, reported stronger erections after 3 months of consistent vacuum training under his doctor's supervision. These stories highlight an important truth. While the device itself is powerful, its success comes down to proper guidance and consistent use. If vacuum therapy is about immediate results, the use of a penile extender is about long-term transformation. This little-known medical device is quietly used by physical therapists and sexual health specialists to improve erectile function, vascular health, and even penile length. The science is both simple and fascinating. By applying gentle, sustained traction, the extender stimulates tissue remodeling, cellular growth, and the development of new blood vessels. Over time, this improves circulation, enhances rigidity, and can result in modest yet permanent length gains. Studies published in the Journal of Urology and BJU International found that men using extenders for 1 to 2 hours daily over 3 to 6 months achieved measurable improvements in both erectile function and penile length. Success, however, depends entirely on commitment. Results take weeks or months, not days. The device should be fitted to your size, adjusted gradually, and worn consistently. Men who expect overnight changes often give up too early, missing out on the profound improvements that come with persistence. Timing matters, too. Extender therapy is best practiced during low-activity times of the day, such as while reading, working at a desk, or watching TV when you can sit comfortably and maintain proper device alignment. It's also worth combining extender use with pelvic floor strengthening exercises, like Kegels or bridges, to accelerate improvements in vascularization and tissue resilience. A protein-rich diet that supports collagen synthesis, including foods like salmon, eggs, and legumes, may also enhance results by aiding tissue remodeling. But here's the caveat. Improper use can lead to discomfort or even injury. That's why consulting with a sexual health specialist or physical therapist before starting is invaluable. They can help you choose a high-quality device, teach you correct protocols, and monitor progress safely. While it remains one of the least discussed options, the penile extender stands as one of the most effective long-term solutions for men seeking more than just a temporary fix. With patience, proper technique, and professional oversight, it has the potential to truly transform sexual health and confidence. And there you have it, 7 powerful, medically supported exercises that can reshape your sexual health, restore your confidence, and give you the performance you deserve. Sexual health isn't a luxury, it's an essential part of your overall well-being. Ignoring it can affect not just your performance in the bedroom, but also your energy, your relationships, and even your long-term health. The good news is that you don't need to wait for change to happen. You now have the knowledge and the proven methods to take control naturally and effectively. The most important step is simply to begin. Choose one exercise from this guide, practice it consistently, and allow yourself to experience the benefits firsthand. Over time, these small, steady actions will build into life-changing results, giving you not only stronger erections, but also greater confidence in every area of your life. If you found this content valuable, show your support by liking and subscribing for more science-backed health strategies designed to transform your life. And don't forget to share your thoughts in the comments. Tell me which exercise excites you most to try, or even better, share your progress along the way. Remember, your best self, full of energy, vitality, and confidence, is just 7 exercises away. I'm Dr. Elizabeth, a urologist with many years' experience in prostate care and men's health. Thank you for watching, and I'll see you in the next video.